two pieces. Today I'm going to cover something I didn't so much research. There's a little bit of information in there. I am going to teach you a little bit about the history of concussions, but more so I'm going to talk about the types, the three levels. This is a little bit of old school, and then I'm going to introduce some of the newer philosophies. But I'm also going to share some of my experiences with them. I've never had a concussion personally, but I've been in the sporting industry for 23 years. So I've been around when some of the, let's say, less professional, less correct practices were in place in handling concussions. I have witnessed it firsthand. And unfortunately, as an intern, I've also participated. So I'm going to give you a pretty real look at the concussion world over the last couple decades in what I have witnessed as an AT. So I'm gonna share some of that with you, and I'm sure some of your parents have said, "Oh, you know what? When I played football, hockey, or basketball, I had concussions, and we just played." Although correct, a lot of that did stem from pressure from the coaching staff and the medical staff. So I'm just going to shed some light on the truths behind and some personal experiences behind the evolution of the care of concussions. So first, I want to talk about a little bit about the evolution and the history of concussions. So in 1928, it was the very first published article on concussions in sport. It started with the words, so Dr. Bennett Omalu was the very first practitioner who first discovered, we'll say, and published the word chronic traumatic encephalopathy, which thanks to Will Smith and the movie Concussion, we now know as CTE, and it's a much more common term used in households. Before, you would never, ever, ever, ever hear the term CTE unless you were knee deep in concussion research. And that's what the medical community in the neurology departments and stuff actually consider concussions. But typically we just know it as a concussion, but it was actually one of the first terms. Now it does go further back than that. This is just the first time it was published, which meant that when it's published, people have to now start being held accountable for it. Was it back in 1928? Also in 1928, we saw the boxers. So football was one area that concussions started to form, but the boxing world was much stronger back in the 20s and 30s than football ever was. And what it was called then was the punch drunk syndrome. And that was obviously from being punched so many times. And the funny thing was with boxers is because they were anticipating to have a sore neck and to have a sore head and to have, you know, a bloody nose and a broken nose and all these lacerations, they never thought too much about the fact that their brains didn't feel well and that they didn't feel right. They just assumed that, you know, this is par for my sport and I'm going to keep going in the ring and I'm going to keep taking punches. And that's where the punch drunk syndrome came from, because they were just like all, you know, drunk feeling. And that was something that's carried over the last 75 years. And in those 75 years, we don't necessarily call it the punch drunk syndrome anymore. But in the boxing world, they definitely still do. And unfortunately, it's pretty hard to come out of that sport without some brain damage. And why it still exists goes way over my head. But it does. And obviously those athletes over the last 100 years have not fared well in terms of quality of life. In the 16th century, a physician by the name of Dr. Perret, he was the first one that used the term the shaken brain. And he also used the words commotion and concussion. So that's how far back it goes. So he interchangeably used the words shaken brain, commotion, because if any of you have had a concussion, you can probably relate to the word commotion. And I haven't used it in a very long time, but it's a really good descriptive term for what goes on in your head. It almost feels like an outer body experience. There's a lot of commotion going on in here and you can't control it. And what we use that is nowadays is the fact that a lot of patients that have concussions can't ground themselves, meaning they can't put their feet on the ground and feel sturdy. They're just feeling like they have no control. And I will definitely go back to using the word commotion from the 16th century because it's actually one that should still be used because it's very, very, very accurate in its description. So back to that 16th century, that was a physician who noticed that people weren't crazy, they weren't nuts, they weren't having mental lapses or breakdowns. They were actually suffering from brain injuries, and that is where the word concussion came from. And we obviously have used that term ever since. So I'm going to generalize basically a concussion. As we all know, it's a coup contra coup, which means that it's an acceleration, deceleration, momentum of the neck, and thus the brain and the head. So just to give you kind of an idea of physics, for those of you who have never taken laws of physics, make sure you do and make sure you pay attention because you will use the laws of physics for the rest of your life, whether you know it or not know it. I use it every single day. But when we're looking at what happens is, let's say in a car accident, so seatbelt is on, we hit another car, our head goes forward in the acceleration, it stops, and we go back in the deceleration. And whether our head hits or not, we have 3 impacts in a car accident, just so everyone knows, 3. So we have the car, which our body is jarred. Then we have our bodies within the car. And then we have our brain within our skull. So our brain tentatively can go through 3 impacts within one car accident. So it is incredibly common to have a concussion with any type of motor vehicle accident. Now, if you think of a football player, let's take a running back, for example, carrying the ball, he's going to go through 2 impacts. So sometimes 3. So we have the impact of the body. We can have the impact of that body onto the ground. We can have the head inside the skull, the brain inside the skull. But here's the problem. We have 4. Now we have 2 or 3 other players landing on them. So in football, so we take a trauma like a car accident and say, wow, like that's got to be where the worst concussions happen. Then walk yourself through a football game. If you guys get an opportunity to go back, I don't know what's blinking in my room. Oh, my light. If you go back and watch a couple old CFL or NFL games, look at the running back and look at the number of impacts that he could have. And it could even be 6, 7, or 8, depending on how many people he hits until he's brought down. Well, every single one of those impacts could be a concussion. And the problem is trying to figure out how many he's had in a game. Well, in a game, there could be tens of there could be 10, 20, 30, 40, 50 of them, all creating trauma to the brain. And this is why it's incredibly difficult in the world of football to determine the severity of CTE. So that's one sport. Then we go something to, let's say, basketball. So this is a sport that I was not anticipating over the last few years of actually seeing that many concussions. And this past Laurentians year, I saw twice as many concussions in basketball than I saw in hockey and soccer, because they had the ball combined. And interesting enough, we don't have football, but interesting enough, it's actually quite common. And it's the elbows up, it's the hitting on the floor. And a lot of my women in my Laurentian women's basketball team suffered 2, 3 of them, maybe 4 of them. And they stayed in a state of concussive state for quite a big portion of their season. And so that's something to keep an eye on. Basketball is not safe from concussions. It's actually one of the most, I'm going to say, starting to get rougher of the sports. So there was a time where football, rugby, what else was on that? Hockey were called contact sports. Now they've been upped to combat sports along with the MMA stuff and boxing. And now you've got basketball, who wasn't ever considered a contact sport, is now in the ranks, same with soccer. And now they're coming up and now are considered contact sports. And I would say about 18 years ago, roughly, LaSalle hosted, well, Sudbury hosted OFSA, and I was perched out at LaSalle. Might have been a little longer than that. And I was studying for an osteopath exam. So my med kit was in one of the gyms, and I was perched reading in a second gym. It was girls basketball finals. And I don't have gloves on. I don't have my fanny pack. I am thinking, whoo, this is the easiest day ever because nothing's going to happen in a girls' basketball tournament. And sure enough, I probably ran out more than I've ran out in an OHL game. And I run out a lot in an OHL game. So, but of course, ball goes dead. Girl goes over top the ball to start getting the ball moving again. Second girl comes over with her momentum and can't stop. So her chin hits the top of the bottom girl's head. I got 2 knocked out, 2 bleeding, 1 in the top of the head, 1 in the chin. And I'm like, ah, shit. I have no gloves and my med bag is way the heck over there. And sure enough, 2 concussions, 2 ambulances, and the whole 9 yards. So that is almost 20 years ago. And Kyle can attest to this because he's been doing it a long time too. Basketball somewhere along the way has become incredibly, I don't want to say rough, but rougher. And the contact is definitely increasing the risk and the chance of injuries, including concussions, in all levels and all types of basketball. So something for you guys to keep in mind. You guys are not out of the woodwork because you play basketball for concussions. So if anybody in this group has ever suffered one or thinks they suffered one, I would like to know. I would like to test you so that we can categorize whether you are symptomatic or asymptomatic, so that as a group, we know whether or not you're starting, let's say, a little more vulnerable because your symptoms are still present, or if they have completely resolved and you are good to go. Just so that's a little bit more information that Kyle and I and Dr. Cam can take, and just in case something happens, as hopefully the world keeps moving forward and we can actually see your faces and spend some time on with you, and you guys can start obviously doing things more as a group. It would be good to know moving into September in the fall, if basketball starts up in schools and stuff, that, you know, we have that little bit of information. But that's a sidebar. Okay, so the other thing I wanted to get into are the 3 categories. Now, we don't actually categorize these anymore, but when I first started 20 years ago, there were 3 levels of a concussion. There was a grade 1, which was a mild, a grade 2 that was a moderate, and a grade 3 that was severe. The grade 1 meant that you didn't lose any consciousness, which was a common one, and you didn't have symptoms that lasted more than about 15 minutes. So you kind of get a bit of a headache, a little dizzy, and then within 15 minutes, you're asymptomatic. That's a grade 1. A grade 2 was one where you may have lost consciousness, but it was for less than 30 seconds and you're not too sure, but your symptoms now last for more than 15 minutes. We take you off the field, we take you off the court, you sit down, my headache hurts, I'm a little nauseous, I'm a little dizzy, and then within 15 minutes, symptoms resolve. We consider that a grade 2. And at that point, we would sit you for an hour. Grade 1, we would throw you back. The grade 2, we would sit you for about an hour and make sure that nothing else happens. And then in grade 3 was loss of consciousness for more than 3 minutes, and typically more like 2 minutes, into 30 seconds, sorry. Loss of consciousness for more than 30 seconds, more like 2 minutes. That seemed to be a very common number. And then it was something that the symptoms lasted weeks, so days and weeks. So now that's a severe concussion, and we would remove you for about anywhere from a week to a month. And that was a grade 3. And then what was happening though with concussions was that we were relying on any type of healthcare practitioner. And let's be honest, our physicians aren't all that well trained in concussion management, and our neurologists are, absolutely. But our family doctors back then didn't really have any more information than the rest of us did. And we were relying on misinformation and your description of what happened to have us determine the grade. So if you wanted to get back on the football field, you were telling me that you were asymptomatic and there wasn't anything I would know better. So away you went. So the grade 1, 2, and 3 got removed about, I'd say 8 to 10 years ago. And it was because we didn't want to not quantify a certain concussion properly. So all concussions were created equal. It didn't matter whether you lost consciousness, didn't matter how long your symptoms lasted. It didn't matter on the mechanism of injury. You were going to be sat for the same amount of time, regardless of when your symptoms resolved. So that's great for mom and dad, but not so happy with the coaches. So your coaches all of a sudden have this asymptomatic player who feels great 24 hours later, and sorry folks, but he's got to sit for an entire week. And the reason is because the majority of brains, especially in our youngsters, will recover in about 7 to 10 days. But again, relying primarily on your feedback and your, basically whether you guys tell us the truth or not as athletes, we had to figure out a platform that kept you safe. And a platform that, regardless of the pressure from your parents, from your teammates, from your coaches, or from the medical staff, it didn't matter. You weren't going back on that court for a week. And that took a lot of pressure off our athletes. And what we were noticing is that they were getting better faster, because stress increases your symptoms and decreases your recovery rate. So something else to keep in mind. So those were the 3 grades that we no longer have. So when we get into next week, keep in mind 1 level, 1 grade, and 1 return to play criteria. It doesn't matter. Doesn't matter what your symptoms are or where you would fall. You are following the same criteria. It is a flow chart, and you have to cover all your bases as an athlete right to the end. Takes about a month to return. By the time you get all the fundamentals through and get the return to play, return to practice, return to a contact practice, and then the return to play notes, and you do everything in between, takes about 3 to 4 weeks, just so you guys know. Now, there are 6 types, and this is where I don't see enough information. I've taken a lot of concussion training, and I have not seen it taught once. But there are 6, and I see all these every single day in the clinic. And we don't just have one type, and the types are basically determined by your symptom. So I'm going to explain them all, but I want you to know that the 6 types are important because it's not, concussions are like snowflakes. Every snowflake is different. Every concussion is different. So we have vestibular, which is balance and where you are in space. We have ocular, meaning sensitivities to light, and things that, like your screens, things like that, TVs, I can't watch a movie anymore. That's ocular. We have mood. And tell me how hard that is to decipher in a teenager. Mood is a type of concussion, and some people never recover, and they always have these short bursts of anger and depression and sadness. That's a mood style. We have anxiety. Here's another one. A lot of people who already have depression and mental health issues, they get a concussion, and it is really hard to determine whether they have the anxiety type or whether this is something they came into with prior to the concussion. But anxiety is a big one I'm seeing, and especially in my teenagers. We have the migraine headache. I had one I've actually got 2 now, but I'd say in 20 years where I've had a couple where they were properly diagnosed and the only symptom they had since day 1 was migraines. No nausea, no sensitivities, no neck pain, no headache, no loss of consciousness, nothing. Just migraines, and they will have them for the rest of their lives. Sensitivity to the brain, and that's the type of concussion they have. And then the last one is also a very common one, and one that's somewhat unfair because it's a cervicogenic concussion, meaning that all their pain sits in their neck. And this one's tough for me because I usually return my athletes a little sooner if the only type of concussion they were diagnosed or I suspected was cervicogenic. And I get a lot of those as well, meaning that they get the neck soreness, tightness, pressure, and then they're given the headache, and that's all they have. And then what happens though is that then can create the sensitivities, the mood changes, and all these other things. But without the neck component, they don't have any of the others, and that's a cervicogenic. So that's no longer necessarily a brain injury. So keep in mind, the brain will heal within 7 to 10 days on its own, technically. However, you are left with ongoing symptoms. And I'm going to explain a little bit about the concussion, what a concussion is physiologically today, just a bit, so that I can reiterate it next week, and hopefully it'll stick with you just a tad, because it's complicated. And I'm hoping if you guys can kind of understand, you'll understand a little bit about when I talk about the treatment piece later, because they go hand in hand. So 3 levels we don't do anymore. 6 types, incredibly important. If you've ever had one and no one has diagnosed you with which type, they haven't done their job. You should know which type you have, because the treatment and the rehab and the recovery is dependent on which type you have. Otherwise, you got to go through it all unnecessarily. Okay, so I'm going to go on the complicated part now. So if you know anything about the brains, you know we have cells. We have an axon, which kind of looks like this, the dendrite, right? And we have, I don't know, the neuron. So the neuron is the cell brain, is the brain of the cell of the brain rather. So in a acceleration, deceleration of the head, now you could be a bump on your bum, it could be something fell on your head, it could be something in basketball, okay? What happens is that the axon that goes like this all of a sudden gets stretched. And imagine a pair of Lululemon pants. So you buy a pair that fits you properly. They're not see-through. Everything's, all the stitching and all the little holes are nice and close. Well, then you gain some weight, or you buy the wrong size that's too small for you. And now those fibers have to stretch apart. Well, when you stretch something apart, you open up the pores, and you open it up so that now it's lighter and see-through. Well, the neuron does the same thing. So when it gets stretched in this whiplash motion, what happens is what it contains inside is calcium. And something called an action potential is the certain amount of pressure outside the cell has to equal the amount of pressure inside the cell. So on the outside of the cell, we have sodium and potassium, and that's called the sodium potassium pump. So things move around in equal parts. But when we stretch it and we now have these little holes, calcium can flow out and sodium potassium can come in. Now we don't have equilibrium. And for those who don't know what equilibrium is, it means balance. And in order to be optimally healthy, our body fights every single second of every single day for homeostasis, equilibrium, and balance. Okay? So when something is taken out of balance, let's say your sugar levels, you just ate a handful of gummy bears. Insulin now has to get released to bring your sugar levels back down because you just threw yourself out of balance. And I could go on and on and on for those examples. So our body is designed, when you screw up, it has a defense mechanism to bring you back down. So in a concussion, we have calcium that flows out, sodium and potassium flows in. We have something called a metabolic crisis. Our body goes into a crisis mode because we are no longer in balance. That's one thing that happens. Calcium now that's flowing in the body is going to find something to bind to. It's going to find some friends. And in the cell, we have something called mitochondria, and they look like little rods, little pieces of firewood stacked together. And what the mitochondria in the cell does is it's the energy producing part of the cell. And in it, it creates cellular energy. And if ATP, which is what it's called, can't be produced, we go into something called an energy crisis. Now, this isn't the fact that you didn't get enough sleep last night. An energy crisis is from here to your toes. It's every cell in your body is now not functioning at the right level of energy. Because what happens is the calcium likes to go in there, and it now takes up the extra space within the mitochondria, and the ATP can no longer be produced. So we have a metabolic crisis and we have an energy crisis. And if any of you have had a concussion, you won't know that you're in a metabolic crisis, but you sure as hell will understand the energy one, because you are exhausted. And the brain has to shut you down in order to try to figure out how to get these balances back. So years ago, decades ago, we would tell the parents or the person you lived with to wake you up every 2 hours and to have a conversation with you to make sure you were lucid and to make sure that you were coherent. We don't do that anymore. We let you sleep. If the brain shuts you down to help it heal, we let you sleep. Of course, without a brain bleed. But in 99% of concussions, we will let you sleep. And that's because the brain is going to shut you down, whether I put you at school, I put you in a sport, or whatever, you're going to fall asleep. And it's incredibly important because we don't know how long that the brain does what it needs to do when we allow it to do so. So the brain is going to shut it down. You're going to sleep a lot. Some people sleep all day for several days. And in that time, what it's trying to do is produce more ATP. So anybody that gets a concussion, I put them on magnesium immediately. The reason is calcium will bind to magnesium before it ever reaches the mitochondria. So magnesium has 200 to 300 processes in the body, incredibly important thing, one of the most vast minerals we have in our body because of its importance. And you stick some extra magnesium in there. It has binding receptors, calcium attaches, and it does its thing instead of it going into the mitochondria. And that's how we help the body in trying to recreate cellular energy. Without the extra magnesium, however, that's why some people never come out of it, because the calcium just keeps coming out and it keeps inundating the mitochondria, and we have a really hard time in helping the body reach that energy system again. So something to keep in mind. I definitely use supplements. And then when it comes to the metabolic crisis, where now we've got this shift in minerals and it causes all this chaos within our nerve cells, that's something that heals, and that's something that we have to leave alone, because there's no way for us to really get in there and fix it. So, however, if we don't get that now stretched out nerve cell back into size, which is what stops the metabolic crisis, then we have an issue because it can actually stay stretched. So if you wear those really tight Lululemon pants too often, you're going to permanently stretch them and they're not going back down to the size 2 that they used to be. So same thing happens inside the body. So it's incredibly important that as soon as you get a concussion, somebody knows about it and you're on the proper road for recovery. If you go back to play and you get a second concussion, we're not bringing those nerve cells back down to size. And that's the double impact or second impact syndrome. And those changes are permanent, unfortunately. And whatever symptoms or deficiencies come with it are also permanent. So incredibly important that if you guys sustain one now, later, wherever, whenever, that we are told about it, your coach is told about it, your parents are told about it, and so that, you know, we can get you guys properly treated. So that's the history in a nutshell. I wanted to give you a little bit of the physiology so that when I re-explain it next week, it's a little more familiar to you. But before you go, I want to give you some of those stories that I was talking about. So one that comes to mind is when I was with the CFL. I was with the Ticats, and I had a receiver lunge for a ball, catches it, and we had another player that was basically at his back. And instead of hitting him, he decided to jump over him and just tapped, and I mean just tapped, the side of the guy's that caught the ball, the receiver that caught the ball's helmet. Now, football helmets are made very different than hockey helmets. Football helmets are designed to have no creases that absorb force. So a football helmet is one solid piece so that the force dissipates over the big area. Unfortunately, hockey was not probably the best design because it has this center funnel that will actually hold force when there's an impact. So this guy gets, and of course they've got these ear pieces, right? These big foam pieces. Granted, most players don't wear their helmets properly, but it's designed to literally disperse the force. So a little bit of tap, player comes off the field, sits down, a little quiet. So, but on the sidelines of a football game, there are tons of things happening. So somebody who walks themselves off and sits, we don't pay attention to. We're paying attention to the taping, the water bottles, you know, all these other things, the injuries that are going on. But he sat there for a while and started to look a little off, a little confused. So I went and sat beside him, and he started asking me like some simple questions like, where are we? What quarter are we in? Who are we playing? So he obviously had enough memory to get him to a certain point in the day. And then one of the players walked by and went, "Oh, how long's he been playing for us?" And I thought, oh boy, here we go. So I'm like, okay. So we do a few of the eye tests, and he functioned very, very well. There wasn't anything wrong with his balance, with his eyes, any of the rest of it, but he had this short little lapse in memory. And so I was like, you know what, we're gonna have one of the wives was a nurse. I said, I'm gonna have her send you to the hospital bring you to the hospital because we just want to make sure everything's ruled out. Well, this story is a funny one. So I'm walking him around the field to her so that not to alert a lot of attention because he was okay in sorts. I just wanted him, to be seen by the emerge. And this African-American woman, very, very boisterous, comes running down off the stands and starts, I don't know how they arms are waving, and she's like, "Where are you taking him?" And then I'm like, I don't know who you are. So I'm looking at him and he's whispering at me going, "I don't know who that is." And she goes off again, "You can't use that with me. You know who I am." And he's like, "Am I dating her?" I'm like, I don't know. You could be married to her. I have no idea. "You don't know who it is?" He's like, "I don't know who this is, but this chick is crazy." And she's going on and off and up one side of him, down the other, giving him shit for not talking to her and pretending he didn't know who she was. Well, sure enough, he turns to her and says, "I don't know if I'm dating you or married to you, but I'm breaking up with your ass." He walked away, completely no clue who she was, till several hours later. He comes back, obviously, to the field with his tail between his legs because his memory came back. So that, as funny of a story as an experience that was, in essence, the fear, though, the scary part is he functioned perfectly fine, except there were just little bits of his life he didn't remember. But I would have put him back on. And he probably would have played a great football game because he remembered football. He just didn't remember certain people and certain aspects of the game in terms of where we were and what quarter we were in. So 20 years ago, that would have gone back. So here's some scarier thoughts. When I was with the NHL, with the Leafs, we had many of them, and most of them at the time were from fights. Helmets off, lacerations, noses are over here. And we used to do one test, and it was a number, a color, and an object. And we used 5 purple grapefruit. But the guys knew it. We never changed it. We never modified it. So, of course, if They said 5 purple grapefruit, couldn't walk, couldn't barely talk. On the ice they would go, and we wouldn't question it again. We wouldn't check them after the game. They passed that silly little thing that they had to recall. It was called an immediate recall test, and off they went. We didn't check eyes, we didn't check balance, didn't check memory, didn't check anything else. We just let them go on. And there are thousands of athletes that we allowed to go back on using their judgment and not any type of medical clearance or diagnosis or restrictions. And it's only since about 2015 that the training in concussions became a little bit more significant. So when I graduated 20 years ago, there wasn't an hour of concussion stuff. We knew symptoms. We knew the SCAT cards kind of came in after that, which is a sport concussion assessment tool. It's a quick little survey type thing that we ask you now on the bench or on the field. But we didn't do that 20 years ago. And it was literally, how do you feel? Do you want to go back out? Do you want to play? And we left it up to the athlete. And now going backwards, back to the chronic traumatic encephalopathy, knowing that those proteins, if you guys saw the concussion movie, those tau proteins are not testable until death. And to give you a sidebar, the NFL asked for, I think they got 18 brains, and 11 of them sustained concussions. 7 of them, the families said, nope, they never got treatment for a concussion. They never got one. They never complained of a concussion. And all 18 except for one player, so 17 of the 18, all had tau proteins in their brain. They didn't get a concussion as far as they're aware, but the proteins were still released into the brain, meaning that you can, just like COVID, be asymptomatic, but still be a carrier. You can get impacts and still have tau proteins released into the brain and be asymptomatic. So it's very important now that any impact, regardless of how trivial you think it is, that you are at least moderately tested for a concussion. And, I've gone back on every single one of my concussions over the last 5 years, and I check up on them at the year mark after I've discharged them and make sure that nothing else has happened. They believe they fully recovered. There aren't any deficiencies, et cetera, because you just don't know. It's not entirely understood, kind of like COVID. There's a list of symptoms like COVID, and then there's atypical ones every single day that just like, I have one guy that if he hears a real screeching sound, he gets so aggressive that if you're in his way, he's going to probably punch you in the head. And that aggression is a problem. And you have to remember that concussions are brain injuries, and they don't follow the same pattern as a rolled ankle or, a broken wrist. So we do have to monitor them all individually and kind of take that symptom set and figure out how to treat everybody separately, because there's no two alike. So those are some of the things. Ty Domi, just so you know, had 1 million of them, and he kept playing. I had, oh my gosh, I don't even know how many football players. There was one CFL game where two of his teammates were holding up his pants. So in football, they have pads, hip pads, and they were holding him up by the belt and whispering in his ear 5 purple grapefruits. And he passed and he played, and this guy could barely stand. So unfortunately, we didn't know what we didn't know back 20 years ago. And regardless of the level of practitioner or the, whether it's an exceptional one or an intern We all did the same thing and we all did it incredibly poorly. But again, we didn't know back then, and we certainly know now. So it's this algorithm and this flow chart is extremely sensitive. Everything is tested, risk factors. You don't just like, you know, the phase 1, 2, and 3 right now, you're not getting to the next phase until you have done the time, passed all the tests. So we're making sure going forward that we do not screw up as many brains as we screwed up in the past. We're going to try to limit, obviously, the amount of CTE that has created a terrible issue with the NFL. I met Brett Favre. He was the Green Bay Packers quarterback for a number of years, and he has 2 little girls. And when I was working with him, he was so thankful that he had girls and not boys. He puts his shoes in the fridge, and then he had one other thing. He screwed one other thing up. Something from the fridge went in the cupboard, and I don't remember what it was. Maybe it was the milk or something. But he's got a brain injury now that he doesn't function every day. And a couple of years ago, the NFLPA, so the Players Association, offered $900 million to the families of past and present NFL players that with the CTE that have committed suicide, committed crimes, you know, obviously have these disabilities now. And they were told them to go back and find more money because it wasn't even going to come close, because they're suspecting that 9 out of 10 football players will have CTE by the end of their careers. So we want to make sure that, unfortunately we can't resolve or we can't eradicate, obviously, concussions, but we can certainly make sure we care for them properly. We can make sure they're diagnosed properly. And most importantly, I think that they're understood properly. Because if you as an athlete understand what I explained today, but most importantly, what I'm going to explain next week, and you don't take them lightly, and then you guys make sure that they're checked and treated, then you know what, we're going to decrease the severity of the long-term effects without a doubt. But if we don't have your cooperation, then unfortunately it makes it awfully tough for us. But I just wanted to kind of start the conversation with concussions. It's an incredibly important topic. So if anybody has any questions or want any tests done, reach out to me. I'd be happy to take a quick look and let you know what deficiencies perhaps still are present, and to give you the right protocols at home to make sure that they're corrected. And next week we're going to go over baseline testing, which is a bit of a fad term. I'll explain to you what that is, and kind of how that's changed over the last few years, how we diagnose and the testing for that, the treatment. I'm going to go over that spreadsheet so that you guys know how that flow chart works, and the return to play and the return to learn, and how that works, and get you guys to understand that nobody has any control over speeding that up. Not your coach, not your family, not you, not players, and not even the doctor, because they don't get you till the very end. So the people that are going to care for you are going to make sure that you hit every one of those stages before you basically get promoted to any type of return to play. So that's what we're going to do next week. And if anybody wants to chime in next week, if you want to put your videos on, and at the end we can certainly chat about any questions because of the importance of this topic, feel free to just put your videos on, and we can chat about it. But otherwise, thanks for listening, guys, and we'll see you next week.